Marshmallow, Althaea officinalis, is a perennial herb belonging to the Malvaceae family, renowned for its soothing and demulcent properties. Traditionally, it was used to create the original marshmallow candy by whipping the mucilaginous sap with sugar and egg whites. This plant has a rich history of medicinal use dating back to ancient Egypt and continues to be valued in herbal medicine today. Growth, habitat, and locations. Marshmallow grows in marshy areas, riverbanks and damp meadows, thriving in wet, salty, or alkaline soil. It prefers full sun but can tolerate partial shade, and it typically reaches heights of 4 to 5 feet. Native to Europe and Western Asia, it has naturalized in North America, primarily in the northeastern and central regions. Identification: leaves, heart-shaped with serrated edges, covered in fine velvety hairs, and are soft to the touch. Flowers, pale pink to white, resembling hollyhock flowers but smaller. They bloom from midsummer to early fall. Roots, thick, white and spongy, with a high mucilage content, making them slimy when chewed or cut. Edible parts and uses. Roots. The roots can be peeled and chewed raw, releasing mucilage that coats the mouth and throat, offering relief from dryness and irritation. They were historically whipped to make marshmallow confections. Leaves and flowers. Both can be used in salads, soups, or teas, though they are slightly mucilaginous. Leaves are sometimes cooked like spinach or used to thicken soups and stews. Medicinal parts and uses. Please note, this video is for educational purposes only. It is not meant to diagnose, treat, or cure any illness, ailment, or disease. Marshmallow's primary medicinal component is its mucilage, which is abundant in the root but also found in the leaves and flowers. It offers significant benefits for digestive, respiratory, and urinary systems, as well as for skin health. Digestive health, acid indigestion, peptic ulcers, and leaky gut. The mucilage coats the stomach lining, providing relief from irritation and acid buildup. It is effective in soothing ulcers, promoting healing, and aiding the repair of the gut lining. General digestive issues, colitis, ileitis, IBS, and diverticulitis. Marshmallow's mucilage forms a protective layer on inflamed or irritated tissues, reducing symptoms of colitis, ileitis, and other inflammatory bowel conditions. It also helps soothe the digestive tract, reducing discomfort and inflammation. Laxative. The mucilage acts as a gentle laxative, adding bulk and moisture to stools, making it useful for constipation and dry stools. Respiratory health, dry cough. Marshmallow is effective for dry, irritating coughs as it soothes and moistens the throat. However, it is not an expectorant. It does not encourage the expulsion of mucus, but rather eases the dryness and irritation. Bronchitis, bronchial asthma, and congestion. The mucilage can help reduce the irritation and inflammation associated with bronchial conditions. It provides relief by coating the respiratory tract, reducing coughing fits. Pleurisy. While marshmallow does not address the infection directly, its soothing properties help relieve the discomfort associated with pleurisy. Teething pain. Chewing on peeled, fresh marshmallow root can offer relief to infants experiencing teething pain, as the mucilage numbs and soothes the gums. It is essential to supervise this use closely, as the root can become a choking hazard. Skin health. Skin, irritations, inflammation, and swelling. When applied topically, marshmallow can reduce irritation and swelling, making it beneficial for rashes, eczema, and dermatitis. Skin ulcers and injuries. Marshmallow's soothing properties make it useful for wound healing, burns, and ulcers. It can be applied as a poultice, ointment, or salve to promote moisture and reduce inflammation. Urinary health, UTI and cystitis. The demulcent and diuretic properties of marshmallow make it helpful in treating urinary tract infections and cystitis. It soothes the urinary tract lining, alleviating pain and inflammation. Harvesting. Roots. The roots are best harvested in the fall of the second year when they are most mucilaginous. They should be carefully dug up, cleaned, and peeled before use. Leaves and flowers. Harvest leaves and flowers in the summer when they are fresh and tender. They can be used immediately or dried for later use. Cautions: slowing absorption of medications. Due to its mucilage content, marshmallow may slow the absorption of medications if taken simultaneously. It's recommended to take marshmallow at least 1 hour before or 2 hours after other medications. Allergies. Individuals allergic to other plants in the Malvaceae family should use marshmallow with caution. Diabetes. Marshmallow may slightly lower blood sugar levels, so diabetics should monitor their blood sugar when using it. Marshmallow is a versatile and potent herbal remedy with a wide range of applications, particularly for digestive, respiratory, skin, and urinary health. Its primary benefit comes from its mucilaginous properties, which create a protective and soothing barrier on irritated tissues. As with all herbs, marshmallow should be used with awareness of potential interactions and appropriate dosages, ensuring a safe and beneficial experience.